Here are the before and afters after one 25-minute treatment. So this is one treatment 10 weeks after, before and afters. Hey guys, Dr. Davin Lim, board certified laser dermatologist. Today I'm at the Fiora Institute. We did a patient, and this is for all you skeptics out there, 10 weeks ago. So this is before and afters, and like I said, I just picked one patient, but we have to pick the patient well. So remember, patient selection is everything when it comes to body contouring. It's not about the device, it's about the patient. If you get the patient right, you pick a device for that patient and their concerns, and you get a good result. So we'll see shortly the before and afters, and ask the patient how things are going. So we've got Ash.
How you going, Davin?
Good, mate. Good. We did. So look, there's no bullshit here, right, guys? So because we've got the before and afters, they don't lie,
No.
and neither will you.
No, that's for sure.
How did you go?
No, it went well. It was, you don't notice it that much yourself, but certainly when I got shown the photos, I could see a huge difference.
Yeah.
Especially on the back part of my hips with my type of body frame.
Yeah.
Certainly is where a lot of my weight sits, and yeah, there was a significant difference.
Yeah, and once again, guys, it's about picking the correct patient. And I'll just show you for Ash, why I knew it worked really well is because of this area here. Basically, he had a lot of excess adipose tissue, fat. However, it was pinchable fat. So when I tested it, I could actually pinch it, but now he hasn't got much at all. And if he tenses, you can see he's actually got his oblique. He's actually got an oblique muscle over here. So he's got his internal obliques over here, and I can't reduce that. If he has a second treatment, can it be demonstrable on ultrasound? Yes, it can, but will it be demonstrable clinically, and will he be happy? Probably not. So if I were to go for a second treatment for this, I'll actually contour it more using another device rather than actually using SculpSure. SculpSure is great for debulking, but for contouring, I prefer this, which is basically Coolsculpting. So Coolsculpting is great for contouring because we can have different applicators. So we have so many applicator sizes here, guys, is that once you get the right applicator size to that patient, you have optimal contouring, and that's what it's all about. It's not about one device, it's about the patient. Once you actually debulk the fat, you can actually contour it using other devices like Coolsculpting, Cooltech, and a lot of the other devices. The more contouring applicators one has, the higher chance that you can have bespoke treatments. So guys, thanks for that. Let's recap on the video, on the original video, which we had with Ash, I think about 3 months ago. And the before and afters just tell the story, and same with the patient as well. Catch you guys later. Bye. So here I've got Trace. Hey Trace.
Hi Dev.
So you are the skeptical wife of Ash, is that right?
I am.
Yeah, and you're always a cool sculpting lady, right?
Yes, I am still.
Yeah, I know you still are, but what did I say about cool sculpting? What did I say about SculpSure? I said it's going to work, and you said?
It won't.
Yeah.
I said
No, you said bullshit.
Well, I did. I didn't think he would have any sort of pain threshold whatsoever. But
Yeah.
you've proven me wrong.
Okay, there
in
you
a big
go.
way.
Okay, there you go. So that's why it's really important. Like I said, it's choosing the right patient, and it's pushing him. So I did push Ash to the maximum tolerable.
He didn't cry.
He didn't cry, no, and that's why we got a good result. So remember, guys, SculpSure, Trace and I are not against it. We actually like the treatment, but I think it's got to be in the right patient, and you do need to push the levels up to get the right results. And we did
100%.
have that, and we did have that for Ash, didn't we?
Yeah, we certainly did.
And it's pretty noticeable.
Very noticeable.
Very noticeable. There we go. Proved it wrong.
You did.
Okay, see ya.
Bye.
Thanks, Davin.
Good. Look, today we're going to do some body contouring. I am using SculpSure in this case. I advocate SculpSure over Coolsculpting for 2 reasons. Number one, you're pretty active, aren't you?
Yes, I am.
Yeah. So he wants to hit the gym straight away. Look, we don't usually advise this with the cool sculpting patients, but with SculpSures you can certainly do that, and that's why I had mine done with SculpSure as well. For us blokes, there's a couple of things as well. Number one, if you look at this, it's really important to assess the patient, because if he wants a reduction here, he's not going to get it with even with SculpSure, because he's actually got very little fat there. What you see, you go, hey, you know, that area, he hasn't got a six pack. Yeah, even, I mean, come on. Look, most guys after the age of 45, we're just losing, hey, we just go downhill. So same with me, you know, there's no way, no six pack here at all. Lucky to have a two pack, but yeah, that's about it. But where we're trying to reduce his fat is from here, and he's got pinchable fat here. You can see how, you know, with this area here, that's subcutaneous fat. So where I think he's going to benefit from is basically his flanks over here and here. If you're going to SculpSure a patient and you're going to do it over here, they're not going to be happy at all, because sure, it's going to reduce by 24-25% over here, but it's only got 0.8 centimeters here. So realistically, our game plan is to reduce here.
Yep.
Are you happy with that?
Yes, very happy.
Cool. So that's what we're going to do, guys, is we're going to treat these flanks and show you how easy it's done. Okay guys, so here we have it. This is the applicator. We can tier the application size and the application spots. So like I said, in this case we're targeting the flanks, and I'll show you why. It's because of this. You see that? If I can actually reduce that by 25%, Ash is going to be very happy. And maybe for guys as well, this is my take on things. We rather want debulking rather than sculpting, because if we have narrow waist, unless you're a bodybuilder, it kind of looks kind of feminine. So at the end of the day, I always believe, that's why I chose this over cool sculpting, is that I want to actually debulk rather than sculpt. And without a doubt, if we're looking at things like in this area here, that will be my cool sculpting mini, full stop. I would not use this applicator off-label around here, but certainly to debulk this area, he's got a very, very good chance of actually doing that with this SculpSure. Okay, so we'll see how it's done from here. Okay, so right now we're just hooking up the applicators. And so remember, this is a sapphire cool device, so we've got gel on that, and the cooling system actually protects the skin whilst the laser energy is being delivered. So what you see is a sapphire crystal cooling system to protect the skin whilst the diode laser is being delivered. Okay, all lights are on, so here we go. This is what we're doing. Okay guys, so we can adjust the settings depending on the pain felt on each side. So you can see how we can adjust that. So each of these sectors are fully adjustable. What we do is that we give patients, the company says to do this, and sorry SculpSure, I'm going against your company guidelines again, that to actually score the pain and hold it at that level. I don't believe that's true. I believe that the higher you go with the settings, the better results you have, because obviously if we're getting fat that's destroyed at a higher temperature, the more effective the treatment. So where I differ is that I do push my patients to actually tolerate this treatment as high up as we can go. So we start somewhere at 0.9 and we push it very quickly to as high as tolerated. Now we just turned it on. It's
You can feel the coolness.
Yep, it's cold. Yep.
Yep.
So guys, this is exactly what it's supposed to do. We've got the sapphire crystals there cooling the skin, and that's protecting the skin. So remember, what we want to do is we do not want the laser energy to actually be transferred to the skin. We want the laser energy to actually be transferred to the fat cells. So that's why he's feeling cold first. The device itself, or the machine, will automatically calibrate, and over time it will increase the settings and hopefully will increase that to a level which is the maximum, because I do advise maximal levels for this. So unlike a cool sculpting, if you've got the generation 1 and even generation 2 devices without dual sculpt, you'll be sitting here for 2 hours, but with this device it's 25 minutes, both sides done and dusted. Okay, so you can see what happens here is that automatically it cools it down first before where we can hit the manual mode. Once we hit the manual mode over here, we can actually increase the settings. So this first bit is the cooling and the energy delivery, and then it actually goes up. So everything's computerized in this setting, and nothing ever goes wrong. So with this device, unlike a laser, it's colorblind. In other words, it can treat any skin color, even really dark skin color, even if you're tan. Remember, even though we're using a laser to deliver the energy, we're not using a laser to heat up anything on the skin. We're heating things up underneath the skin. And how it works is much like the other devices. We're actually killing the fat cells and using the body's immune system to excrete the fat cells over a period of 3 months or so. So once again, a very safe system's been with us for at least 2 years now. And like I said, I like using it in this setting for debulking rather than sculpting. Okay, so the first 4 minutes of the cycle has elapsed, and that's the cooling phase. And now we're into 21 minutes. So he's got 21 minutes left. Well, not really. He's got 19 minutes and whatever seconds left to actually finish off the cycle. So right now, when we ask Ash, he should be feeling a little bit off. How do you feel now, Matt?
Yep, fine.
Fine.
Feel the warmth.
Yep, the warmth now.
The warmth.
Yep.
Yep.
So now the cold counteracts the warmth. So what happens to your brain at this stage? It's got kind of fried because you're feeling cold, but you're actually feeling warm at the same time. Is that what you're feeling? Cold and warm, and don't know what to really think of it.
Yeah.
Yeah. So that's what I mean. When I had this procedure, is exactly what I felt. Going, hey, this is cold, but I'm actually feeling warm. I don't know what to think of it. And what we do is that gradually we push the patients up. So he's got, you can see the countdown. Remember, it's 21 minutes left, and over that time, I do expect him to go up to nearly the maximum level. So we'll check on him later. It looks like he is 15 minutes, nearly 16 minutes into his cycle. He's got 5 minutes left, and he's pushing the levels up. Pain-wise,
No, pain's pretty good. Just as it starts to feel like all that's getting a bit sore, it cools down and goes through its cycle again. So it's
very
good.
Cool. So you've got a heat cooling cycle. Yeah, makes
Yep.
it more comfortable.
Yep, it certainly does.
Good. Okay, so this is the home stretch. We're counting down 50 seconds. He's almost at the max. We're just going to push it up to the max. Push it up to max. So we're at 1.4. Probably go up a little bit higher than that. That's it. So guys, we're at the max. He's got 40 seconds left, and he should be feeling it now. Feeling it now?
Yes, you certainly feel it get up to the
hot
spot.
Yep.
But yeah,
So
doesn't stay there long though.
No.
It cools down, goes back up.
Yep. Your wife told me you're quite a wuss, but mate, look, at 1.4 you're actually the highest setting, so I think I have to eat my words, and I think your missus owes you an apology. So anyway, I'll let that...
Can we get that on film?
Yeah, it will be on film, and you can have that over that conversation over dinner, because I don't want to be there.
Okay.
But anyway, guys, that's it. End of treatment, and that's it. Overall, comfort-wise, pretty.
Oh yeah, very comfortable. But not uncomfortable at all.
Okay, guys. Yeah, that's it. Guys, this is what it looks like with the applicator off. Unlike Coolsculpting, where you have to massage, it's very cold. It's actually quite cool there. Even though we've heated the outside, heated the inside, the outside of the skin is actually cold. So you feel that?
Yeah.
It's actually cold. Yeah. So the cooling system works to protect the outside, but obviously we're treating underneath. So that's the reason why in this situation I like using SculpSure over Coolsculpting or Cooltech, because we have nothing to massage. We can prod over here and it's not painful. And certainly with if anyone's had a Cooltech or Coolsculpting done, it is certainly painful afterwards, especially the massage, because that's essential for this. Let's just leave alone, and you're right to go to the gym this afternoon. And hence, like I said, different shoe sizes for different people. So what are the realistic before and afters like? Well, these are 2 treatments taken 12 weeks from beginning to end. You can see that it's a good debulking procedure. Once again, 2 treatments. It's a great debulking. So it's not for contouring, but reduction of overall fat. And once again, on the flanks. Once again, it's not as good as Coolsculpting or Cooltech, but sure, it can debulk. The gold standard for body contouring is to find a device that is suited to your needs, i.e. your body type. That may include Coolsculpting, it may include Cooltech, it may include a variety of devices or combination of devices. And once again, downtime plays an important role in regard to this. If you have loose skin and you would like tightening, certainly thermage may play an important part. And once again, this is also dependent not only on your needs and expectations, but also on your clinical examination and the ethnic skin type of the patient. So thanks once again for joining me this Saturday morning in regards to body contouring. So for all you new viewers, I do 1 new video every Saturday morning Brisbane time. So please subscribe if you'd like to know more about the latest and greatest in aesthetic and laser dermatology. Bye.